Look, there are some countries where they actually have guidelines that say that you can't actually treat a child with medication for an ADHD diagnosis until sleep has been assessed. And I think that's actually a very sensible approach, especially when you've got statistics of 25 and up to 50% of ADHD kids actually having a sleep problem. And we have plenty of studies showing that once that ADHD diagnosis is addressed by virtue of treating their airway problem, then the ADHD goes away. So it wasn't ADHD. So that's part of the ADHD story. Glass of water. And then from that point of view, the concentration and so forth goes with it. In terms of chronic tonsil inflammation, I mean, that's sort of part of the problem and also not necessarily part of the problem and so forth. So chronic tonsil inflammation manifests itself either with enlarged tonsils, okay, which ties in with the airway problems, or it also ties in with tonsil stones. So chronic tonsil inflammation can be tonsil stones. The tonsils don't necessarily need to be big. They get a low-grade sore throat, a little bit of redness around the tonsils, and this terrible bad breath. So that's sort of I just wanted to round off chronic tonsil inflammation there for you. So hopefully sort of I've answered what I think the question was there. Again, feel free to sort of ask again and clarify if I'm not getting on point there. So next one I've got in front of me. We've got a child with adenoidectomy and turbinate, so I'm assuming that the child's had surgery, ongoing venous pooling, general open mouth posture, a little bit of teeth grinding, a little bit of learning difficulties, narrow palate, and the suggestion that no evidence to support palatal expansion. Okay, all right, so this is a little bit of a complex topic, so this might take a little while. But I'll do the best I can to try and keep this simple, okay? The first thing that you need to look at in terms of what this sort of general presentation is what we're talking about is a child that can't breathe through their nose properly, okay? And if you keep it simple, it can be simple. So the reasons that a child cannot breathe through their nose properly is because of either something that's inside the nose or outside the nose that's a problem. Now, in terms of outside the nose, let's start at the front, this part of the nose, sitting outside the nose at the front, okay? Sometimes when people sniff in, these side walls of the nose will collapse in, okay?